Hello, welcome back to Neonatal Clinical Series.
Today we will discuss one of the most commonly used drugs, which is dobutamine. As we all know, dobutamine is widely used and is considered a narrow therapeutic index drug, so we have to know everything about it to get the best benefit from it, taking into consideration the adverse effects that may occur.
In this video, we are going to discuss some important points. First, adrenergic receptors. To understand the mechanism of dobutamine, we have to revise first the adrenergic receptors. Secondly, we will discuss the mechanism of action of dobutamine. Then we will talk about the use of dobutamine and its indications. And of course, we will discuss the drawbacks of dobutamine and how to avoid them. Later, we will discuss the special considerations while using dobutamine to avoid any medication errors. Finally, we will explore dobutamine dosing in neonates. Without any delay, let's start. As we know, there are two types of adrenergic receptors, which are alpha and beta receptors. Alpha receptors are found in the vascular system and are divided into two types of receptors, alpha-1 and alpha-2. Alpha-1 receptor, responsible for increase the vascular resistance, which will lead to an increase in the blood pressure. So by giving the patient alpha-1 agonist, we are expecting a vasoconstriction effect. Alpha-2 receptor is quite different from alpha-1 in action, as it inhibits norepinephrine release, so alpha-2 agonist causes vasodilation and hypotension. Now, let's talk about beta receptors. There are two types of beta receptors as well, which are beta-1 and beta-2. Beta-1 is located in the heart. It is responsible for the contractility and heart rate, so if we give a beta-1 agonist, we are expecting that it will increase the force of contractility and increase the heart rate. Beta-2 receptors, found in the vascular system, pulmonary system. It is responsible for vascular and pulmonary vasodilation. So by giving the patient beta-2 agonist, we are expecting vasodilation and pulmonary dilation. The problem is most of the drugs used in the ICU interacts with multiple receptors, not just one. Going back to dobutamine, now we know the receptors and how they work. We could easily anticipate the effect of dobutamine in the body. Dobutamine works mainly as a beta-1 agonist, so it works mainly on the heart muscle, increasing its contractility and heart rate. Hence, it is an inotropic and chronotropic drug. It also works on alpha-1 receptor, so we are expecting a vasoconstriction effect. However, it works on beta-2 receptors as well, and as we previously mentioned, beta-2 causes vasodilation. So, which effect do you think will occur while using dobutamine?
Dobutamine has a higher affinity to beta-2 receptors than alpha receptors, so actually it may cause vasodilation, which may cause hypotension in high doses. This is a very important point that we have to keep in mind, as this means that if we have a patient in a hypotensive shock, we cannot give him dobutamine, especially in high doses, as it may worsen the hypotension.
The use of dobutamine in neonates. Let's think for a while. According to dobutamine action, what is the case that needs a drug that will increase heart contractility and cause pulmonary vasodilation? Exactly, pulmonary hypertension. Dobutamine can be used in the treatment of pulmonary hypertension. However, it cannot be used in hypotensive patients, as we discussed before. What are the other conditions that we can use dobutamine in? Again, according to its mechanism, it is a chronotropic and inotropic drug, so it can be used in case there is a heart problem while the systemic vascular resistance still performing normally. Example: neonatal circulatory failure with significant cardiac dysfunction. Also, dobutamine may be the drug of choice during the transition period in premature neonates, secondary to its ability to improve contractility of the immature myocardium and decrease afterload. Now we will discuss some special considerations to be done while using dobutamine. First, since dobutamine effect works immediately, and with the fact that it is a narrow therapeutic index drug, Start with the lowest possible dose and titrate slowly, taking in consideration the efficacy and the adverse effects. Secondly, this drug works on the preload in the heart, so we have to make sure that the body contains enough fluid before increasing the preload. You might need to give a bolus saline before adding dobutamine. Make sure that the patient is not on beta blocker, as beta blocker antagonize the effect of dobutamine. If the patient suffers from seizures and is on phenytoin, make sure to monitor blood pressure, as phenytoin will increase dobutamine hypotensive effect. As we discussed before, any drug works on the heart muscle may cause arrhythmias, so we have to monitor the heart while using dobutamine. Do not administer dobutamine or any inotropic drug through an umbilical catheter. Finally, while giving dobutamine through 4-line and infiltration occurs, inject phentolamine to the affected area. And that's it. Thank you for watching. Please like the video and subscribe to our page to get to see all our videos. If you have any questions, kindly leave them in the comments. Cannot wait to see your comments and suggestions.